So if the pathogen releases DNase and it degrades the DNA, it makes it easier to move through that DNA. I think these are pretty straightforward, so things like phospholipase C that degrades the phospholipid bilayer, I think you can understand why that would be detrimental to one of your cells. If you're getting rid of that phospholipid bilayer, then your cells are going to die. Collagenase degrades collagen in connective tissue, and that allows the pathogen to have access to new areas. So I don't think these are anything that are very difficult to understand, but you must know them for the exam. So this just shows what Staphylococcus aureus would do if it was surrounded by DNA from the dying cells, from these dying cells. It would release things like DNase to allow the exoenzyme DNase to break down the DNA so that it can move through. And it would also want to be able to have access through these dying cells to be able to access new areas. So it might release another exoenzyme like phospholipase C to destroy the phospholipid bilayer. So these cells would then it could then get past these cells. Because remember, tissue represents a barrier for the pathogen to move past. So collagenase, I already talked about this, it degrades collagen so the pathogen can then get through the collagen area into a new area. Sometimes that is even a blood vessel, and if it gets into the blood vessel, it can then travel to new areas of the body very far away. Endotoxin, the only endotoxin you guys need to know is lipid A, which can also be called LPS. Know that it's part of the gram-negative, and it's attached to the gram-negative cell. Just by its mere presence, LPS causes the immune cells to recognize this, and they bind and try and phagocytose it. LPS causes the change in the body to LPS causes the body to change the temperature and by causing fever, and that the reason why we do that is so it's not optimal for the pathogen to survive. So by the mere presence of LPS and the white blood cells trying to phagocytose it, they release cytokines which causes fever, and in extreme cases can even cause inflammation and shock over time. So endotoxin versus exotoxin. Exotoxins, these are primarily exoenzymes. So gram-positive bacteria particularly release exotoxins. They are protein enzymes. Specific damage, they can be denatured by heat, and their LD50 typically is a low LD50, which means it only takes a little bit of them to cause cells to die. Gram-negative bacteria typically express endotoxins, like we talked about the LPS. That's the only one you guys need to know for this class. It's systemic symptoms of inflammation and fever. It's heat stable because it's part of the bacteria, and the LD50 is typically high, so it takes a lot of these guys to cause you to become sick. However, it can be systemic, and that can be very detrimental and lead to shock. Okay, so exotoxins and the pathogens, you need to know the ones we talk about specifically, and the ones we talk about specifically I'll get to in a second here. So AB toxins, you have to know that the B subunit allows for that toxin to get into the host cell, and the A subunit is an enzyme. So when the A is bound to the B as shown here, that enzyme is inactive, but once inside the cell, the B releases the A subunit, and that allows the A subunit to become active. So if we look, for instance, at the diphtheria toxin, so the B subunit allows for the entrance of the A subunit into the cell. Once the A subunit is released from the B subunit upon entry into the cell, the A subunit attaches to ADP ribose. It attaches ADP ribose to an elongation factor that is used by the ribosome. That when that elongation factor, EF2, is ADP ribosylated, when it has ADP ribose added to it, that causes the ribosome to stop. So because that ribosome then stops, then you no longer have protein translation. So you're no longer making proteins. If you're no longer making proteins in that cell, eventually that cell will die. So the botulinum toxin, that botulinum toxin is going to block the release of acetylcholine. If you block the release of acetylcholine, that is going to stop muscle contraction. So for instance, in smooth muscle, like the heart muscles, if you stop muscle contraction, that means the heart stops beating. So the botulinum toxin causes paralysis, and when it stops muscle contraction, if that reaches the heart, that then causes death. It's one of the most toxic toxins that we know about. For the tetanus toxin, this does the exact opposite. So the tetanus toxin prevents the release of glycine and GABA, and that prevents relaxation of the muscle. So here we can't relax the muscle, so we'll start a contraction and we will not be able to stop that contraction. That's why with tetanus you get things like lockjaw. So no release of GABA means that you cannot do relaxation of the muscle. So virulence factors to evade the immune system. So the capsule prevents phagocytosis because it becomes harder to phagocytose that larger cell. The capsule also can block antibody binding, and so the capsule can also allow for that antibody to try and bind to the capsule, and then you can release an exoenzyme of a protease, which will then break down the antibody because the antibody is a protein. So capsules are typically found on pathogenic bacteria, not non-pathogenic bacteria. So viral adhesive factors, for instance, hemagglutinin is on the flu virus, influenza, and that allows it to attach to the sialic acid of the respiratory cells in our lungs. So when you breathe in the influenza virus, these spikes that stick out are the attachment factors, and that is hemagglutinin, and that will attach to the cell in our respiratory tract. So this just tells you herpes simplex virus has glycoproteins that stick on the mucosal membranes of the mouth and genitals. HIV has GP120, which you guys should already know from when we went over viruses, and that attaches to CD4. SARS-CoV-2, which causes COVID-19, its spike attaches to the ACE2 receptor in the epithelial lung cells. And yes, you need to know that for the exam. So viral antigenic drift versus antigenic shift. Antigenic drift happens because of an accumulation of mutations, and that happens over time. So you will have mutations that occur over time. Those mutations that happen to the DNA over time cause mutations to the proteins that they code for, and that can give you, for instance, what we're showing here is a mutation in a spike. So now we have a different spike, and now that antibody cannot bind to that spike because it doesn't recognize it anymore. So a drift is an accumulation of mutations over time. Shift, however, is when a host has two viruses inside of its same cell, and those viruses then mix their DNA together. Because those viruses mix their DNA together, that causes a totally new virus to be expressed or made. And so this happens rapidly because it happens inside the cell that is putting together those two different viral particles with their two different viral genomes. And it makes a mistake and mixes them up, and that creates a totally new virus. So SARS-CoV-2 is infecting people, it's accumulating mutations, and over time it will show antigenic drift. So people now that make antibodies against the original SARS-CoV-2, over time those antibodies won't be able to bind to that new SARS-CoV-2 mutated antigenic drift virus, and then they will get sick again. This is what happens every year with the flu as well. That is chapter 15.